it's great to have a project to try to increase mammography screening and to increase pap smears. But if the members of those communities are most concerned about the fact that their kids are getting shot, then you're coming at them with your priorities and not their priorities. So equity means that in the improvements that you're trying to make, you need to listen as much as talk. People with schizophrenia die 20 years earlier than people in the rest of the population, and you can't have equity in healthcare if you don't have equity in mental health care. It's treating the entire health of the person. So I'm Gillian Friedman. I'm the Chief of Staff at Patton State Hospital. I'm kind of the link between the administrative team and the medical staff. That's part of my day, but I also have a clinical caseload. I work seeing patients. I work exclusively with female population, and most of whom have some sort of serious and persistent mental illness that has, for one reason or another, led them into the legal system. There's a segment of the population with mental illness that seems to rotate, and so if you lose them to care, they're going to end up back in the system in another way, and in a setting that is less ideal. So we need a more, as much as we can, to be thinking about coordinated, stable teams of care over time, because for people with severe and persistent mental illness, the people they interact with are very important. We're not interchangeable cogs. The relationships they form with their treatment providers are key. Once somebody is discharged, there are all sorts of things that can, just for reasons of bad luck, happen that will throw somebody off course. If you have diabetes that requires insulin injections, good luck in finding a board and care facility that will take you. And I've seen this while I've been at Patton. Somebody who fails in the community and ends up in something that brings them back to a state hospital, when really, if they had the ability to live in a place where somebody would help them with medications, they really wouldn't have ended up back there. So something as simple as that can derail an entire community placement for somebody who has a psychotic illness. There is another component to that is improving the diversity within the psychiatric workforce. So the team that I work on currently at Patton, the psychologist I work with is a native Spanish speaker. Somebody will respond completely differently to her because she's speaking to them in Spanish. And I'm talking not just about ability to understand what I'm saying. If somebody were translating for me and it's me asking the questions, I will get a completely different response because of the level of comfort that somebody has talking to somebody who is a native speaker. When we have a workforce of providers that is not diverse, then we don't serve well the community that we need to serve. So I have spent part of my career diagnosed and treated for attention deficit hyperactivity disorder. And the earlier part of my career not diagnosed. It's not the same as having a severe and persistent mental illness that completely takes you away from. So I'm not trying to say that I understand what it's like to have a manic episode or to have a psychotic episode. I think my fear all along in the rest of school, and then I think up until a certain point when I was diagnosed, was that there was some inherent character weakness for me, that no matter how hard I tried, that something about me I was always going to let people down. And it wasn't really until I was diagnosed as an adult, and I had already been working as a psychiatrist for a long period of time, And along with getting appropriately treated with medication, which helps a lot, actually. The second part of that was to reconceptualize what the meaning of the symptoms meant for me. And that allowed me to develop my own skills and strategies to deal with them once I was no longer seeing them as character flaws. And I see the same thing in working with people who have serious and severe and persistent mental illnesses, psychotic illnesses, severe mood illnesses, that it's just as important to deal with what the meaning of the symptoms are for the person. And yes, treating the symptoms is important and it can be a prerequisite to doing some of the other work, but also allowing people to understand that they can be successful even with a mental health condition that needs treatment. I get to make a real connection with people who don't always have that in the care that they've received, but also in the interpersonal relationships that they have had for one reason or another. And I get to try to provide a healing experience, one where they feel listened to and where they feel that somebody is being compassionate with all of the problems and issues that they bring into the situation.